Most heart attacks do not begin the way people expect. Many older adults imagine a sudden collapse, severe chest pain, or dramatic symptoms that appear without warning. But doctors often explain that the body usually sends signals hours before a major heart attack happens. The dangerous part is that these warnings are often quiet, confusing, or mistaken for normal aging, stress, indigestion, or simple fatigue. In many cases, the body begins struggling nearly 24 hours before the actual emergency, but because the symptoms feel mild or unrelated, they are ignored until it becomes too late. This is why awareness becomes so important after 50, because the earlier these warning signs are recognized, the greater the chance of preventing severe heart damage or even saving a life. One of the earliest and most ignored warning signs is unusual fatigue that appears suddenly without a clear reason. This is not normal tiredness after a busy day. It is a deep exhaustion that feels strange, heavy, and difficult to explain. Some people describe feeling completely drained, even after resting or sleeping well. Everyday tasks that usually feel simple may suddenly seem physically overwhelming. Walking through the house, carrying groceries, climbing stairs, or even speaking for long periods may feel unusually exhausting. Doctors often warn that this happens because the heart is beginning to struggle with circulation, reducing oxygen delivery throughout the body. The muscles and organs start receiving less support, and fatigue becomes one of the first silent signals. Many seniors ignore this symptom because it develops gradually over several hours. They assume they are simply getting older, not sleeping enough, or recovering from stress. But when unusual exhaustion appears together with pressure in the chest, shortness of breath, or discomfort in the upper body, it should never be dismissed. The body is often warning that the heart is already under serious strain. Another major warning sign is pressure, tightness, or discomfort in the chest that comes and goes. Contrary to popular belief, heart attack symptoms do not always begin with unbearable pain. Sometimes the sensation feels mild at first, almost like fullness, squeezing, burning, or heaviness in the center of the chest. Some people mistake it for acid reflux or indigestion because it may appear after eating or while resting. Others describe it as if something heavy is sitting on the chest. Doctors explain that this discomfort often occurs because blood flow to the heart muscle is becoming restricted. The heart is not receiving enough oxygen, and pressure begins building inside the chest. What makes this symptom dangerous is that it may disappear temporarily before returning stronger later. Many people feel relief when the discomfort fades, believing the problem has passed. But in reality, the body may be experiencing temporary interruptions in blood flow before a complete blockage occurs. This is why intermittent chest discomfort should never be ignored, especially in older adults with high blood pressure, diabetes, or circulation problems. Shortness of breath is another warning sign that often appears before a heart attack. Some individuals notice they suddenly become winded while doing simple activities that never caused problems before. Others feel breathless while lying down or resting quietly. Doctors often explain that this happens because the heart is struggling to pump blood efficiently, causing fluid pressure to build around the lungs. As oxygen circulation becomes weaker, breathing feels more difficult and tiring. This symptom can be especially confusing because it may appear without chest pain. Many seniors assume they are simply out of shape or aging naturally. But unexplained shortness of breath, especially when combined with fatigue or chest pressure, should always be treated seriously. The body may already be showing signs that the heart is under dangerous stress. Another silent warning sign is discomfort spreading into other parts of the body, especially the left arm, shoulders, neck, jaw, or upper back. Some people feel aching, numbness, or pressure that seems unrelated to the chest at first. Others notice strange pain in the jaw or shoulder without understanding that it may be connected to the heart. Doctors explain that heart-related pain often travels along nerve pathways, causing symptoms to appear far from the chest itself. Women and older adults are especially likely to experience these unusual pain patterns. Instead of dramatic chest pain, they may feel soreness, pressure, or heaviness in the upper body that develops slowly over several hours. Because the discomfort feels indirect, it is often ignored until more severe symptoms appear. Cold sweats are another major warning sign many people underestimate. Sudden sweating without physical activity, especially when combined with weakness or nausea, may indicate the body is reacting to severe internal stress. Some individuals describe feeling clammy, pale, or suddenly overheated. Doctors often warn that this happens because the nervous system becomes activated when the heart struggles to receive enough oxygen-rich blood. Nausea, stomach discomfort, or indigestion-like symptoms can also occur before a heart attack. This is one reason heart symptoms are so frequently misinterpreted. Some seniors believe they are experiencing food poisoning, acid reflux, or digestive upset when the real problem is reduced blood flow affecting the heart. The discomfort may feel like burning, pressure, bloating, or fullness in the upper abdomen. In many cases, these symptoms appear together with fatigue or sweating, creating a combination that should never be ignored. Another important warning sign is dizziness or sudden lightheadedness. As circulation becomes unstable, blood flow to the brain may temporarily decrease. This can create feelings of weakness, imbalance, or faintness. Some people feel as though they might pass out, while others experience confusion or difficulty concentrating. Doctors explain that these symptoms may indicate the heart is no longer maintaining stable circulation effectively. Heart rhythm changes may also appear before a heart attack. Some individuals notice pounding, fluttering, or irregular heartbeats that feel unusual compared to normal. Others feel sudden episodes where the heart seems to race or skip beats. While not every irregular heartbeat is dangerous, doctors often warn that sudden rhythm changes combined with fatigue, chest discomfort, or shortness of breath require immediate attention. Sleep disturbances sometimes appear in the 24 hours before a heart attack as well. Some people feel restless, anxious, or unable to sleep comfortably. Others wake repeatedly during the night, feeling uncomfortable or breathless. This may happen because the body is already under cardiovascular stress, even before the actual heart attack begins. One of the biggest dangers is how easily these symptoms are dismissed. Many older adults convince themselves they are overreacting or assume the symptoms will pass. They may avoid seeking help because they do not want to cause alarm. But doctors repeatedly emphasize that acting early saves heart muscle and increases survival chances significantly. The longer blood flow remains blocked, the more permanent damage occurs inside the heart. Another critical fact is that symptoms do not always appear dramatically all at once. Sometimes they build slowly over hours. Fatigue may appear first, then mild chest pressure, followed by shortness of breath or sweating later. Because the progression is gradual, people normalize each symptom individually instead of recognizing the dangerous pattern forming together. The body almost always tries to warn before a major cardiac event occurs. It sends signals through circulation changes, exhaustion, pain patterns, breathing difficulty, and nervous system reactions. The problem is not that warnings are absent. The problem is that they are misunderstood. Doctors often emphasize that older adults should pay close attention to sudden changes that feel unusual for their body. Even if the symptoms seem mild, a strange pressure in the chest, unexplained weakness, sudden sweating, pain spreading into the jaw or arm, or shortness of breath during simple activity should never be ignored after 50. The heart works constantly every second of life, and when it begins failing to receive enough oxygen, the body reacts quickly. Those reactions may appear 24 hours before the actual heart attack, creating a critical window where medical attention can prevent catastrophe. Recognizing these signs early may protect not only the heart itself, but independence, mobility, and life. Another warning sign that many seniors overlook is sudden weakness that feels different from ordinary tiredness. This weakness often appears without heavy physical activity, and may create the feeling that the body has suddenly lost energy overnight. Some people notice their legs feel unstable while walking, while others feel too exhausted to complete normal daily routines. Doctors often explain that when the heart struggles to pump efficiently, the muscles stop receiving enough oxygen-rich blood, causing the entire body to feel weak and drained. This symptom may appear many hours before a heart attack actually occurs. In some cases, the body also begins showing subtle signs through changes in skin color and temperature. The hands may feel unusually cold, the face may appear pale, or the skin may become clammy. These changes happen because circulation begins redirecting blood toward vital organs as the heart experiences increasing stress. The body enters a protective state, trying to preserve oxygen delivery to the brain and heart itself. Unfortunately, this often means reduced circulation reaches the skin and extremities first. Some doctors also warn that unusual anxiety or a strong feeling that something is wrong can appear before a major cardiac event. Many patients later describe experiencing unexplained nervousness, restlessness, or discomfort before the heart attack happened. While anxiety alone does not mean a heart attack is coming, sudden emotional distress combined with physical symptoms like chest pressure or breathlessness should never be dismissed. The nervous system and cardiovascular system are deeply connected, and the body often reacts emotionally when circulation becomes unstable. Another important warning sign is sudden sweating during rest or sleep. Waking up drenched in sweat without fever or overheating can sometimes indicate the heart is under severe stress. Doctors explain that the body releases stress hormones when oxygen delivery to the heart becomes compromised. This hormonal response may trigger heavy sweating, shaking, or feelings of panic. Many people mistake this for a bad dream or temporary illness, but combined with chest discomfort or fatigue, it may signal something much more serious. Heart attacks can also produce symptoms that resemble ordinary digestive problems. Some individuals experience bloating, burping, nausea, or upper stomach pressure instead of chest pain. This is especially common in older adults and women. Because the symptoms feel digestive rather than cardiac, many people delay seeking help. Doctors often warn that discomfort in the upper abdomen, together with fatigue, sweating, or shortness of breath, should always raise concern for possible heart problems. Another hidden sign involves difficulty recovering after mild physical activity. A short walk, carrying groceries, or climbing a few stairs may suddenly leave a person unusually breathless or exhausted. Recovery may take much longer than normal. This happens because the heart's ability to deliver oxygen-rich blood has become weakened. Activities the body once handled easily now place significant stress on the cardiovascular system. Some people also notice pressure or discomfort that spreads into the back between the shoulders. This symptom is commonly misunderstood because it does not feel directly connected to the chest. The discomfort may feel dull, aching, tight, or burning. Doctors explain that heart-related pain often radiates through shared nerve pathways, causing symptoms to appear in areas far away from the actual heart itself. One of the most dangerous aspects of heart attack warning signs is that symptoms may temporarily improve. Chest discomfort may fade, breathing may feel easier for a while, or fatigue may decrease briefly. This temporary relief often creates false confidence. People convince themselves the danger has passed, when in reality, the blockage inside the arteries may still be worsening. Doctors repeatedly warn that symptoms coming and going can actually be a classic sign of unstable blood flow before a major cardiac event. There is also a strong connection between heart attack risks and sleep disruption before symptoms become severe. Some seniors wake repeatedly during the night, feeling uncomfortable, restless, or unable to breathe deeply. Others feel pressure in the chest when lying flat, or notice their heartbeat feels unusually strong while resting quietly. These nighttime symptoms are often ignored because they seem minor compared to dramatic heart attack scenes shown in movies or television. But real heart attacks frequently begin quietly and gradually. Another critical warning sign is unexplained dizziness while standing or moving. When circulation becomes unstable, the brain may not receive consistent oxygen supply, leading to lightheadedness or faint feelings. Some people feel unstable while walking or suddenly need to sit down after standing. This symptom becomes especially concerning when combined with chest pressure, sweating, or weakness. Doctors also emphasize that diabetes can make heart attack symptoms even more difficult to recognize. Many diabetic patients experience reduced nerve sensitivity, meaning chest pain may feel much weaker or may not appear at all. Instead, symptoms like fatigue, nausea, dizziness, or shortness of breath become the primary warning signs. This is one reason silent heart attacks are more common in older adults with diabetes. Another overlooked symptom is sudden loss of physical endurance. Activities that once felt manageable may become frustratingly difficult within a short period of time. Some individuals stop exercising, avoid stairs, or sit down more frequently without realizing their heart function may already be declining. This gradual loss of stamina is often blamed on aging alone, but doctors warn it can reflect worsening circulation problems inside the arteries. The body's warning system before a heart attack is rarely random. Symptoms often appear together in patterns. Fatigue combines with sweating. Chest discomfort appears alongside shortness of breath. Weakness develops together with dizziness or nausea. Recognizing these patterns quickly is what saves lives. Waiting for unbearable chest pain can be extremely dangerous because many heart attacks never begin that way. Medical experts repeatedly stress that immediate treatment during the early warning stage can dramatically reduce heart damage. Restoring blood flow quickly protects heart muscle and improves recovery outcomes. But every hour of delay allows more tissue damage to occur. This is why ignoring symptoms or waiting to see if it passes can become life-threatening. The truth is that the body usually whispers before it screams. 24 hours before a major heart attack, the warning signs are often already there. Fatigue, breathlessness, chest pressure, sweating, weakness, nausea, dizziness, unusual pain, or overwhelming exhaustion. The danger is not always the absence of symptoms. The danger is misunderstanding them until the heart can no longer compensate. For many seniors, these subtle changes are the final opportunity to act before a life-changing emergency occurs. Recognizing them early may prevent permanent heart damage, protect independence, and save precious years of life. As the heart continues struggling before a major attack, the body often becomes less able to regulate circulation properly. This can create sudden episodes of extreme tiredness during ordinary moments of the day. A person may wake up already exhausted, feel drained after taking a shower, or suddenly need to sit down during simple conversations. Some doctors explain that this happens because the heart is working harder than normal just to maintain basic circulation, using enormous energy even while the body is resting. Another important warning sign appears through breathing changes during sleep. Some people begin snoring more heavily than usual, or wake up gasping for air during the night. Others feel as though they cannot take a deep breath comfortably while lying down. This can happen because fluid pressure slowly builds around the lungs as circulation weakens. When the body is horizontal during sleep, the heart may struggle even more to move blood effectively, making breathing feel strained or uncomfortable. Many seniors also notice unusual swelling in the feet, ankles, or lower legs before heart problems become severe. Swelling happens because weakened circulation allows fluid to collect in the lower parts of the body. Shoes may suddenly feel tighter, socks may leave deep marks in the skin, or the ankles may appear puffier by evening. Doctors often warn that swelling combined with fatigue and breathlessness should never be ignored because it may signal developing heart failure alongside blocked arteries. Another subtle but dangerous sign is unexplained sweating during mild activity. A short walk, light housework, or climbing a few steps may suddenly trigger heavy perspiration. This happens because the heart is under stress and the nervous system reacts by activating sweat glands as circulation becomes unstable. Some people notice cold sweat forming on the forehead or palms, even when the room temperature feels normal. In many cases, appetite changes also begin appearing before a heart attack. Some individuals lose interest in food completely, while others feel full quickly, or experience nausea after eating small amounts. Doctors explain that when circulation becomes compromised, digestion often slows down because the body redirects blood toward more critical organs. This can create bloating, stomach pressure, or uncomfortable fullness that feels unrelated to the heart. There is also an important connection between heart strain and mental clarity. Reduced oxygen circulation can affect the brain, leading to confusion, forgetfulness, or trouble concentrating. Some seniors notice they feel mentally slower or emotionally overwhelmed in the hours before a cardiac event. Others describe a strange sense of detachment or fogginess that feels difficult to explain. These symptoms occur because the brain depends heavily on healthy blood flow, and even small circulation changes can affect cognitive function. Doctors also warn that jaw pain is one of the most overlooked heart attack symptoms, especially in women. The discomfort may feel like aching near the lower jaw, tightness around the mouth, or soreness spreading upward from the chest or neck. Because it resembles dental pain or muscle tension, many people fail to recognize it as a cardiovascular warning sign. Yet pain traveling into the jaw can indicate serious interruption of blood flow to the heart. Some people experience unusual back discomfort before a heart attack as well. This pain often develops between the shoulder blades and may feel like pressure, tightness, or deep aching. It may come and go over several hours, becoming stronger during physical movement or emotional stress. Doctors explain that the nerves connected to the heart can send pain signals into the back, creating symptoms that seem unrelated to the chest itself. Another dangerous sign is feeling faint or unstable after standing up. When the heart cannot maintain stable blood pressure effectively, dizziness may occur more frequently. Some seniors notice sudden weakness while walking, or feel as though they might collapse unexpectedly. These circulation changes can become especially dangerous because they increase the risk of falls and injuries before the actual cardiac emergency even occurs. One reason heart attacks become deadly is because many people try to push through symptoms instead of responding early. Seniors often continue doing chores, running errands, or waiting until the next day to seek help. They may fear embarrassment or believe they are overreacting. But doctors consistently stress that early medical attention is what saves heart muscle and preserves life. Delaying treatment allows the blockage inside the arteries to worsen, increasing the risk of permanent damage or sudden cardiac arrest. Another important fact is that symptoms may appear differently in each person. Some experience chest pressure first. Others notice fatigue, nausea, dizziness, or breathing changes before any chest discomfort develops. This variety is exactly why heart attack symptoms are so frequently ignored. People expect one dramatic sign when the reality is often much quieter and more confusing. In older adults, especially those with diabetes or high blood pressure, symptoms may be even more subtle. Reduced nerve sensitivity can weaken pain signals, making a serious heart attack feel mild at first. Doctors often warn that unexplained exhaustion, sweating, weakness, or breathlessness may actually be the body's primary warning system in these individuals. The body almost never fails without warning. Long before the heart reaches a breaking point, it usually begins sending signals through circulation changes, nervous system reactions, fatigue, pain patterns, and breathing problems. The challenge is recognizing those signals while there is still time to act. Some medical experts explain that the 24 hours before a major heart attack are often the most critical. During this time, blood flow inside the coronary arteries may already be dangerously unstable. Small clots may form temporarily, oxygen supply may fluctuate, and the heart muscle begins struggling to function normally. This creates the symptoms many people dismiss as stress, aging, indigestion, or simple exhaustion. But these are not ordinary symptoms when they appear suddenly, repeatedly, or together. The body is asking for help, and recognizing that request early can mean the difference between recovery and tragedy. Protecting heart health after 50 is not only about medications or medical tests. It also requires paying attention to sudden changes that feel unusual for your body. Fatigue that appears without reason, pressure in the chest, swelling in the feet, unexplained sweating, jaw pain, dizziness, nausea, shortness of breath, or weakness during simple activities should never be treated casually. Because sometimes the heart attack itself is not the first warning. Sometimes the real warning comes the day before, quietly appearing through symptoms most people never expect.